A patient with dengue fever having platelet count of 20,000 without any signs of bleeding, what is the appropriate treatment? What is the treatment? So first of all, it is an uncomplicated dengue. So main treatment will be hydration and paracetamol we will give for the fever. And looking at the options, can we give paracetamol? Yes, we can give paracetamol. Steroid we will only give it in the case of shock. And platelet transfusion is only done when there is sign of bleeding and the platelet is less than 10,000. PRBC infusion is done when it is complicated and there is shock. We will go through all these options in detail, but first we will discuss what sir has told. Then we will do the platelet transfusion when platelet transfusion is not indicated unless the patient has active bleeding or platelet count is less than 10,000 even without bleeding. Okay, so in dengue fever, supportive care is the mainstay. Maintain hydration, use paracetamol for fever, avoid NSAIDs like aspirin, ibuprofen as they increase bleeding risk. PRBC and steroids are not indicated in uncomplicated dengue. Okay, so what the book says. So this is the latest treatment update of 2025 that for dengue without warning sign as such the case has given to us. Main thing is to give the ORS, that is oral hydration. Then for fever we will give the paracetamol. So of course paracetamol can be given. What we have to avoid, we have to avoid all the NSAIDs. Now if dengue is with warning signs, what we will do? First we'll do the fluid adjustment. Okay, now in fluid we have to take care that we should not overhydrate. Now in severe dengue there is dengue shock syndrome. Now if the hematocrit increases, that means there is capillary leakage and hematocrit is increased, we have to repeat the flood bolus. If the hematocrit decreases, which indicates that there is a blood loss. So if there is blood loss, we have to do the blood PRBC transfusion. Okay, so when we have to give the blood transfusion, when there is massive leak, which will be indicated by shock and low hematocrit, so we have to give the PRBC. If there is severe bleeding, then we have to give PRBC with platelet. When we have to give the platelet transfusion, when there is platelet count is less than 10k, but we have seen in the question that platelet count was 20k, so it is not the indication for platelet, and there is no bleeding. So even if there is no bleeding but the platelet count is less than 10k, we will transfuse. But if it is less than 20k with minor bleeding, we will transfuse. And in question we have seen that the platelet count was 20k but there was no bleeding, so we will not transfuse. And the third criteria is if there is major bleeding with any number of platelet count, we will transfuse. So this is the criteria for platelet transfusion. So in that question we will not transfuse platelet. Now third case is when there is organ failure. We will not go through this. Now what are the medications that are allowed? Paracetamol is allowed and steroids are also allowed except in the refractory shock. Okay, so in refractive shock steroids are not allowed.